Exactly.
So, insulin resistance is something that people really don't understand. I mean, I think they've been hearing a lot more about it because of Ozempic, and weight loss is just a term that's being bandied about a bit more. So I know that people have been clamoring to find out more about it. But they do know, I think, the term metabolic syndrome more. But let's talk about that for a minute.
Okay.
What is metabolic syndrome, and what is the connection to insulin resistance?
Okay. So insulin resistance can lead to metabolic syndrome. And many people, almost all people with metabolic syndrome, have insulin resistance. Metabolic syndrome, it's really a collection, it's a cluster of conditions that happen together that increase your risk of heart disease and increase your risk of diabetes. So what are those conditions? It is a combination of that increased weight in the middle combined with an increase in blood pressure, an increase in blood sugar, high triglyceride levels, which is one of the components in the cholesterol ring, and actually combined with a low HDL, which is always coined the good kind of cholesterol. So it's that increased weight in the middle, high blood pressure, high blood sugar, high triglycerides, and low HDL. And usually we think if you have three of the above, you're considered to have metabolic syndrome.
Got it. And as we know, this all of these that you just described, are really very common in women in their 50s and beyond. We know that, but of course, we also know that there are things that we can do, which we will get to.
Sure.
But what are the most common health issues that can happen? If someone, I think you mentioned some of them just now when you were describing metabolic syndrome, but what are some of the most common symptoms if you have insulin resistance? What are they?
Well, insulin resistance, because you have insulin resistance, you're going to have higher insulin levels. And higher insulin levels have been tied, not necessarily causative, but we certainly know associated and possibly causative of an increase in cancer risk, definitely an increase in diabetes, type 2 diabetes risk, an increase in weight gain, particularly in the middle, an increase in cardiovascular disease, an increase in polycystic ovarian syndrome in younger people, an increase in dementia. Most recently, we're noting that people that have high insulin may be also tied to an increase in dementia, definitely an increase in insulin inflammation. So all of these factors can be from a high insulin. So preferentially, a lower insulin or a stable insulin is healthier than having chronically elevated insulin levels.
So how do you know if you even have insulin resistance? How do you know this is even happening in your body?
So one is a clue is if you have signs of metabolic syndrome, high blood pressure, increased waist in the middle, this is a clue. If you notice that your waist is increasing disproportionately to the rest of your body, thin arms, thin legs, but only the middle is increasing, that's a clue. Things on physical exam, if there's a darkening at the neck and it looks like you have a ring or it looks like you have a dark necklace, but actually it's your skin. Also darkening in the what we call antecubital, in the opposite of your elbow. If it's dark there, or darkening under your arms,
meaning like the crease in your arm,
the crease
when you
in
bend
your arm.
it?
Yes,
wow.
yes. If it's particularly darkened, or under your arm, if you under your arms get particularly dark, that can often be a sign of insulin resistance. Not always, but the neck darkening as well, and especially if it's a velvety dark increase, that can be a sign. And sometimes an increase in tiny little skin tags that you get particularly under the arm, around the neck, can also be a sign of insulin resistance. Now, that's on physical exam. There are some blood tests that you can get. We'd like to look at a fasting insulin level, which would be elevated, and a fasting glucose level, as well as a hemoglobin A1C. That is a measure, hemoglobin A1C is a measure of what your sugars have done over the last 3 months. So if that level is elevated, that's also a hint that there probably is some insulin resistance happening. So those are some major tests. There also are some stimulation tests that you can do. You can get a glucose or insulin tolerance test where you go in fasting, you drink this sometimes terrible tasting sugary drink, and then you measure your sugar and insulin levels every half an hour, then an hour, then 2 hours, and even 3 hours. And you can watch what your insulin does over those 3 hours. So that can be really helpful. So that's the way that you can diagnose whether or not you have insulin resistance.
But again, you did mention that if you have some of these other factors, it's probably likely that you either have it or are heading in that direction.
Right.
So let's talk about how you can prevent it or even treat it. Prevention. Let's start with that.
Right.
I think I can predict what some of your answers will be, but let's go for it.
Right. Well, I mean, exercise is critical.
Right.
And exercise is so helpful because exercise alone can help those same factors, GLUT4, that you need to take sugar and turn it into energy can really facilitate that ability. And so if you're exercising, any amount of exercise is going to be helpful. But exercise, particularly if you're doing a fast walk and you notice that you are a little out of breath or it's a little hard to carry on a conversation, that is ideal. But you do want to be able to carry on a conversation. You don't want to be constantly out of breath, but that can be really helpful if you do that every single day. That can really help keep your sugars even. That can be helpful. Also, diet is being careful to have an appropriate, healthy diet. In order to decrease insulin resistance, one that has high protein and low carbohydrate has been found to be particularly helpful. So that is something that may be able to be preventative as well, or at least if it's there to prevent the continuation of insulin resistance. So I think diet, exercise, getting sleep, and managing your stress, that can be helpful as well. Limiting your alcohol intake, really limiting the simple sugars, trying to avoid those. If you are going to have carbohydrates, have complex carbohydrates, have more fiber. And
I think
of course,
the big question is it reversible?
It is reversible.
Okay.
It is reversible, and this is definitely something that we can work on. Certainly helpful, and you know that I always say that reach out to a healthcare professional and get help. Diet and exercise, you want to make sure that you are under the care of somebody that is helping you to do all of these factors. And it never hurts to rule out any other underlying issue that may be participating in causing the insulin resistance. Then there may be other factors that are involved. And I'm sure we can talk about some medication in terms of treatment as well.
Yeah, of course. I mean, if some of these lifestyle changes aren't really helping to get rid of the insulin resistance in your body, what are the medications that can help?
So there are some over-the-counter products which can be helpful, but I always, I'm saying this with quite a caution because I really want people to get the help of their particular healthcare professional. But there are some over-the-counter insulin sensitizers which have been shown to be beneficial. Inositol is one of those. And then for medications, only under it's prescription and under the care of a healthcare provider would be metformin, which is an insulin sensitizer. There are some newer agents which work with the sodium channels that affect sugars that have been used. And now the newer GLP-1 receptor agonist, which has gotten a lot of attention, can be extremely helpful in
You mean like Ozempic and Wegovy?
Ozempic, Wegovy, Mounjaro, and I'm sure we're going to have some more coming out. Rybelsus. These are all different agents. So basically semaglutide is what we're talking about, which is an agent. And then there are others that are helpful in reversing insulin resistance. In other words, they are great insulin sensitizers.